Hey guys, welcome back to Urology 101. I'm James Farrell. Urology 101 is my video blog, and it's on common topics in urology. They're taboo and embarrassing pretty often just because we're talking about sex organs a lot. Now my goal is to get you some useful information that you can apply, so this video and all my others, if you like it, are on my website, which is urology101.com. Now the first part of that is spelled Y-O-U-R. Maybe you're watching this on YouTube. The channel name is Urology 101. All the videos are there too. And for all of you watching this, please check me out on Instagram if you're not following me already. Great content, shorter format. I post most days. Urology 101 is the name. Now with that, let's get into today's topic, which I want to start with just kind of getting a question out there. Are you ever really skeptical of what your doctor recommends? Like, do you go through the consultation and at the end they say something and you just think, there's no way that that's going to work, or there's no way I'm going to do that, or some 300-pound doctor looks at you and tells you, you know, I think really what you need is to lose some weight. I think that might help, right? I mean, sometimes recommendations from us come across just completely skeptical because of either how they're presented, maybe they're the wrong thing, or maybe the person presenting them just doesn't look like they fit the right part. So one of the things I want to talk about today is one of those where I've had patients be pretty skeptical, and fortunately I've had a lot of people really happy that they went through it, and I think it works well. It's for overactive bladder, and it's called urgent PC. The real name for it is called PTNS, or Percutaneous Tibial Nerve Stimulation. And this is really cool, right? It is a fusion of some Eastern medicine in the form of acupuncture plus some Western medicine, and it works, right? There are a lot of alternative medicines out there, and we know lots of people seek that. Some of those have great science behind them. Many of them, unfortunately, have very little research, and some of them may not be that safe or healthy. But this is one that bridges all of that and works. And I think it's a great example of how different types of treatments or different types of philosophies can come together and provide you a good benefit, which is great. So again, let's work on overactive bladder for a second. It's that unwanted urge to urinate that comes across many times in a day. Sometimes it goes along with incontinence, sometimes not. There are some behavioral things you can do if you want to check on those and go over that again. My video early on in all of my video series was, oh no, I gotta pee again. Check that out. It has lots you can do on different behaviors you can try to reduce your overactive symptoms and some medications. Now, if you've been through that stuff, if you've done the medications, or if you don't want to, then keep listening to this. What this is a way to try and reduce those unwanted urges, maybe reduce the incontinence, and just get you to a better quality of life, right? Like, we may not get rid of the problem, but if it gets a lot better, that's pretty good. Now, what we do actually is take an acupuncture needle, which you can see is really thin, apply it to a little electrode, and then that generator puts a little electricity through that, and the needle goes behind your ankle on the inside. And where we're getting close to is something called the tibial nerve. The tibial nerve contracts your calf muscles. And what some really smart scientists found out several decades ago was that if you stimulate the tibial nerve, or stimulate with electricity and contract those calf muscles, that inhibits bladder contractions. And it's called a reflex arc, and it makes sense, right? If you are using your calf muscles and you're running from a predator, or you're running for any reason at all, or you're using them, you usually are not going to stop to go, I should really take a piss right here, right? That's not going to happen. So with the tibial nerve stimulating, that is a reflex arc that inhibits bladder contractions, and overactive bladder are unwanted excessive bladder contractions. So this really works. And what you do is you end up coming to our office for about 30 minutes once a week for about 12 weeks. And you can sit there and read or listen to music or do whatever. It's not something that's too bothersome. It's going to feel like your foot's vibrating a little bit. And the side effects are minimal. You're not going to get infections in the leg there. You might get a little bit of bruising, but that's about it. So the main side effect is your time. And then over the number of weeks, we just kind of see if things start to get a little bit better. And if they do, there are ways to do maintenances where you can kind of come like once a month or something like that, or just, whenever your symptoms feel like they start coming back, you can come on back. But you don't have to have anything implanted in your body. You don't have to have the unwanted side effects of some medications. You don't have to go through a surgery. Most insurances do cover this pretty well, and it's a nice answer for overactive bladder. So I think it's really cool because it offers some aspects of alternative therapies with some Western medicine that has some really good research behind it. And it just does a nice job of taking care of people with minimal side effects. So if somebody brings it up as an option, check it out. If you have questions, send me your questions. Otherwise, take care of yourselves and your families, and you guys have a great night. We'll see you soon.